Hi, my name is Maya, and today I am going to be demonstrating a wet to dry dressing change. So the first thing I'm going to do is check my doctor's order. I'm going to gather all my supplies. So here I have my dressing change tray, my gauze, my 4x4s, my clean gloves, some saline, wound measuring guide, and some more saline. So after I've done that, 30 minutes prior to actually doing the dressing change, I would go ahead and assess my patient for any pain. And if they are having pain, I would go ahead and give them any kind of PRN pain meds. And now I'm going to wash my hands and I'm ready to speak to my patient. So hi, my name is Maya. I'm going to be your student nurse today. Before we get started, can I verify your date of birth? Okay, and do you have any kind of allergies? Okay, so no tape, no latex, anything like that? Awesome. So today I'm going to be in here for about 10 minutes. We're going to be going ahead and doing a dressing change, okay? Do you have any kind of pain right now? Okay, so we're good. So now I'm going to go ahead and I've already asked for allergies and all of that. So now I'm going to go ahead and get ready to change the dressing. So I'm just going to make sure my patient's comfortable and I'm comfortable and we're both safe. So I'm just going to raise the head of the bed. I'm going to make sure my patient has used the restroom or done everything they've needed to do before the actual dressing change. I'm going to go ahead and put a sheet protector underneath the patient just to protect the sheets, and we are ready to get started. So I'm going to go ahead and wash my hands again, and I'm going to go ahead and put on some just clean gloves. So we're going to pretend like my patient has a dressing on them. So I'm going to go ahead and just lift up the tape away from my patient's skin on both sides, and then I'm going to look at the ABD pad. So on the ABD pad, I'm just going to be looking at the amount of drainage. I'm going to be looking for the color, any kind of odor, the consistency, all of that. So after I've got that off, I'm going to throw it away, and we're going to go ahead and get the packing out. So that's why I have my sterile syringe. We're going to squirt it because it just makes it easier to get out. And while I'm removing all of the packing, I'm just going to be checking in with my patient, seeing how they're doing. So after I've done that, I'm going to throw that away, take off my gloves, and we're going to go ahead and wash my hands with soap and water. So now I'm just going to be assessing my wound. So actually, so now I'm just going to be assessing the wound. So I'm just going to be measuring the wound with my wound guide. I would go ahead and reapply some gloves. I'm going to be measuring the wound with my wound guide here, just putting over it. I would be making sure for any kind of tunneling, making sure I'm noting that with the base of the clock. And then I'm just going to be looking right now to obtain any kind of cultures. I'm going to be looking for infection. I'm going to be looking for the skin edges, the pain, the drainage, the wound head, the surrounding skin, all that kind of stuff I'm going to be looking at now. So after I've done that, I'm going to go ahead and wash my hands again, and we're going to go ahead and open my sterile dressing supplies. So right here, we're going to open it. I have to push my little head up. Okay, we're going to open it. I'm going to go ahead and just remove my sterile gloves. I'm going to also go ahead and open my drape. Making sure to only touch these little corners, and I'm just going to place it away from me. And if it did touch anything like this, then it wouldn't be sterile anymore, but I don't really have a head at the table, so. Now I'm gonna go ahead and dump everything on my sterile tray. Please don't fall, please don't fall off, please don't fall off. And it fell off. So that wouldn't be sterile anymore, but for this video's sake, we're gonna pretend like it didn't fall off and it's clean. So now I am going to go ahead and in my tray, I'm gonna go ahead and just take this off. And we're gonna dump our saline in here. So I have my saline. I'm gonna open it, putting the top up. And I'm gonna dump my saline in here. After I've dumped my saline here, I'm gonna go ahead and put on my sterile gloves. So can you stand up and show this? So show my gloves. And so I'm just gonna open my package. Only touching the corners. And with my dominant hand, I'm gonna pinch. And we're gonna slide in. These gloves are kind of difficult. And my fingers are messed up, that's okay. So now for this one, I'm gonna scoop with my finger. And if I had touched the patient, we'll pretend like the patient wasn't there, but if I had touched the patient, these will not be sterile anymore and I would need new gloves. So now I can fix my hands and everything. Okay, you can go back over there, please. Thank you. So now I have my sterile gloves on, and now we're gonna go ahead and clean the wound. So I'm gonna go ahead and wet my 4x4s. I'm gonna go ahead and put my 4x4s in there. And I've got my forceps here. And making sure to wring this out. I'm gonna go ahead, this is a big clump of 4x4s. Sorry, but I'm gonna go ahead and make sure we're cleaning the patient wounds. So we're gonna go from clean to dirty to top to bottom. So I'm gonna go clean, one wipe, and I'm gonna throw this away. Let me get a trash can. Sorry, give me 1 second. Let me just pop this on the floor. So we're gonna pretend like that was already there. And so I'm gonna get more 4x4s. See if I can just pick up one. So I got another 4x4. I'm gonna wring that out. And then I'm gonna go ahead and clean the other side of the wound, top to bottom, clean the dirty. And we're gonna drop it. And then my last 4x4. And then if I needed to repeat this cleaning, I could just have used less 4x4s and clean it again. So now after I've done that, I am going to go ahead and take off my sterile glove. I've already cleaned it, so I'm gonna go ahead and take off my sterile gloves. I'm gonna throw these away. I'm gonna wash my hands. And now we're actually ready to go ahead and apply the wet to dry. So now, there's my trash bag in there, but sorry, I should have took out my trash bag first. But now I'm gonna go ahead and make sure I'm maintaining my sterile field, so I know that everything above my waist is sterile. I'm gonna make sure not to turn my back on the sterile field. I'm gonna make sure that nothing dirty touches the sterile field, and if it does, then I know it's not sterile anymore. And I'm just gonna be really conscientious of that. So now I'm gonna go ahead and open my sterile gauze packet, which is right here. So I'm gonna open that. And then I'm gonna go ahead and dump it on the sterile field. And after I've done that, the amount of gauze that I use is depends on how big the wound is. So I dumped them all out just to be safe. And so now we're gonna go ahead and apply saline to the gauzes. So this would be a bigger one, and I would just put saline on them. And so now I'm going to go ahead and pack the wound. So I would have my sterile gloves on. I should have took them off, but put my sterile gloves on again. And we're gonna go ahead and just, these are wet. And then I'm just gonna go ahead and place them into the wound. And then I would go ahead and, with using my forceps, and my forceps did hit the outside 1 inch, so these would not be sterile anymore. So I would have to get a new pair. So I'm gonna go ahead and just push these in. Ooh, she's sliding off. So I'm gonna go ahead and push those in. And then I would go ahead and do another layer. And then after that, I'm gonna go ahead and pick the ABD pad out. We're gonna place it on the patient. And we're gonna go ahead and tape it down. Oh, we would do a better taping job than that. And then I'm gonna go ahead and just label it right here. So I'm just gonna put the dressing change date and my initials on it. And then I'm gonna go ahead and take off my gloves, wash my hands, and I would go ahead and document everything. So that is it. Thank you.